Welcome to today's presentation. I'm going to talk about mental health issues and how to cope with them. I believe we are all going to learn something, and please remember to subscribe so that you don't miss out on these presentations. Today we are going to learn about mental health issues and just an understanding of what it is. Mental health issues refers to a wide range of conditions that can affect us psychologically, emotionally, and a social well-being. So again, things that disrupt our normal ability to do things, normal work schedules, and normal even interactions with the family. Now, these are conditions that can impact someone's thoughts, feelings, behavior, and overall the functioning of a person, as I earlier stated. Some of the examples include depression, anxiety, schizophrenia, obsessive compulsive disorder, post-traumatic stress syndrome, and all that. Today we are not going to delve so much on that, but those are some of the conditions that they come on: bipolar disorder and all that. Mental health issues are common and can affect anyone, so we need a lot of understanding among ourselves in a family, and support and treatment as well. Remember, it is not a sign of weakness or personal failure, but rather they turn out to be medical conditions that need attention. Now, some of the common symptoms include persistent sadness, irritability, lack of appetite, not feeding, not sleeping well, withdrawing from activities that they normally enjoy doing, not meeting goals or objectives. Even in the workplace, they difficulty concentrating, they feel worthless or rejected and all that. And some of them have excessive fear and worry. Some even exhibit unexplained behaviors. Somebody reports that they no longer understand them, and that again could be. Some even feel like harming themselves or killing themselves. So those thoughts cross their minds. It is important to seek help, and when we notice some of this, sometimes the person may not realize that they are going through or they're losing it. So it's important when you notice it's a family member or a work colleague, we need to raise the alarm, we need to help out, we need to reach out and help them to seek help. Now, how do we cope with these mental challenges? Remember that even in times, difficult economic times like the way it's happening in the world now, you may not have it all together. Retrenchment, lack of jobs, you're not able to meet your obligations. Again, somebody can need to seek help. How do we cope? One of them is seeking help, seeing a therapist, talking it out, seeing a counselor and a psychologist, or even a psychiatrist. Another way is building support network, and we need to encourage the family members, the friends, the work colleagues to help this person to form that support group so that they are able to receive the help and receive the support that they need. We need to practice self-care. Again, despite all this, despite what we are going through, we need to have a routine for exercise. We need to have a routine for meditating. We need to have a routine for balanced diet, so making sure we have enough sleep, setting goals which we are able to meet, relaxing techniques, pursuing our hobbies, and all that. Another one, the fourth one, is setting realistic goals. So again, make sure that you set realistic, achievable goals so that you are able to meet them. Don't demand too much on yourself when you're not able to, or the time does not allow. Another one is developing healthy coping strategies like writing down, journaling, listening to music, nature walks. Those are relaxing techniques that can help. Again, seeking support. It is important that you seek support. Prioritize. Another aspect is prioritizing self-compassion. As I said, be kind to yourself and love yourself. Another one is limiting stressors, identifying them, reducing. As you said, set goals which are realistic. Delegate tasks and manage your time effectively, and we'll be able to avoid increasing so much pressure on yourself. The eighth one is staying connected to friends, connected to people, and also to flip this coin on the other side, that if somebody has suddenly lost interest, they are not getting in touch, they are not keeping to themselves, you need to reach out to them because they could be undergoing some stressing situations. So staying connected, as we mentioned, and finally consider self-help resources like, reading books and online available online options for seeking help, mobile applications that help connecting with your spirituality, praying and attending religious events. All this help. So I hope today we have learned something on identifying that yes, these things exist.